So what you see is different stages of life, and probably everybody talked about productivity gains, right? So when you're all productive, you need somebody to take care of you. That's where healthcare comes into picture, right? So right from your childhood all the way till nature takes you back, you need healthcare, right? And what we have seen is the number of practitioners or service providers in healthcare is not adequate in any country or any time zone, right? So that's where we thought about bringing in technology to help healthcare. I'll just take you through the current scenario of how healthcare works, right? So again, these are all AI generated images, so there's just want to make that clear, right? So any person anywhere, be it in any part of the town or country, so if they are sick, all that happens is they rush to the nearest primary healthcare center. If they're convinced that there is something, they might go to the next specialist out there, or maybe they're administered a test of some kind, and if everything works correct, there's some diagnosis, right? And the challenge here is it's always time consuming, right? The other day I was reading that a simple EEG test, it takes just 30 minutes. In Orissa there is almost a 90-day waiting time for that. And God forbid if any one of them is an epileptic patient, the chances of death are immense, right? So, and this is on the diagnostic part. Similarly, doctors and clinical assistants, they are also hard, they are always hard pressed for time. They are just not able to cater to the load. Now I work with a few neurologists in Mangalore. They consult almost 150 patients in a day. Their day starts around 7 in the morning and they go on till 11 with barely a break of 15 minutes or half an hour. And they end up becoming patients themselves in the next few years, right? So that's the thing. And imagine a patient with an undiagnosed condition, right? So it's not just a financial burden, it's a psychological burden as well, not just on the patient but on the family as well. Nobody knows what's happening. The quality of life drops drastically, right? And that is where in all of this what we lose is the patient centricity and the care, right? So this is where we thought AI can help us, right? So what are we thinking about here, right? So imagine a patient sitting, like I was talking to one of the gentlemen here, right? So all of us are from different parts of the country, and even with the same language there are a lot of different dialects. So how do I communicate well with a doctor, right? How do I share my symptoms? That becomes the challenge. So this is where we brought in real time conversational AI, right, led by a physician assistant. Just a simple chatbot. All the patient does is pick up the phone and talk to the chatbot, telling what the symptoms are, and basis that my prompt trained physical assistant is able to book an appointment with the right clinician with a near 70-80% accuracy. And mind you, we are not getting into the business of diagnosis, and that is where the doctors still hold the fort. We will not do anything that will determine the patient's healing outcome. We are just here to support the doctor, right? The other thing, like Ashok was talking about, the document summarization, right? So there are certain clinical notes, case histories that run into hundreds of pages. I have personally seen a patient with a 20-year-old case history. It was 300 pages. They carried 2 bags of case history. Imagine if a senior specialist has to go through all of that summary to even diagnose, right? So that is where we brought in a simple document summarization application in there, right? And now, if you see this process, right? So a patient, they have a virtual consult with a physician assistant. They get to share all their documents, be it a voice note, be it their case histories, or now a lot of IoT devices have come up which are able to track biomarkers, right? And we're also in the process of building some low-cost biomarkers where you can connect to it and make sure all the biomarker signals are sent. I know of research done here within Bangalore where they're using teardrops and saliva to predict diseases that can affect the human 20 years from now, right? So put all of this together, you're building a digital twin of a patient, right? And making sure that there is real-time monitoring all along, and alerts can be sent. Hey, if some person is susceptible to any kind of ailment, be it a food allergy, be it a weather allergy, right? Using the IoT devices, you can actually track them and make sure the patient and their caretakers are informed well in advance that, hey, there is an issue, please go consult the doctor, right? What we are trying to achieve with all of this is efficient, cost-effective treatment and quicker diagnosis, right? And again, the advantage, there's long-term health assessment, preemptive monitoring. It improves the patient care. It improves the psychological well-being of not just the patient, but the family also. And more importantly, it gives time and space for the doctors to consult with patients rather than just go through the whole process of reading case histories or writing prescriptions. Another thing that I have not put here that we have recently implemented is just translating prescriptions. The medical compound is in English, yes, but the dosage and the administration is given in the patient's native language that they are comfortable in. And we also have QR codes on all the prescriptions now. So at no point in time can the patient or the pharmacist or the family feel that, hey, they have lost it. Your smartphone, just take a photo of the prescription, the QR code, you're able to present it anywhere and your prescription is always there. Effectively, what we have tried to do here is that build case histories of patients that are available and digitize whatever we have. My current system has case histories of almost 20,000 epilepsy patients across the past 30 years. So now any new patient walks in, I know based on the demographics what kind of treatments are successful, what are not successful, what kind of drug reactions are there, what can be adverse. So this is what we're trying to achieve, and we hope to do it soon. Thank you all.